Hi, my name's Julianne Tyker, and I did my project on the AIDS epidemic in the Tampa Bay area and chose to focus on Hillsborough and Pinellas County. Little background information about the Tampa Bay area. It's located on the Gulf Coast of Florida. As you can see from this map here, some of the counties included in Tampa Bay are outlined. I just chose to focus on Hillsborough and Pinellas County as they're the most highly populated and have had recent increases in HIV in those counties specifically in recent years. The population of them is approximately 2.4 million, with about 40% in Pinellas and 60 in Hillsborough. Additionally, it's home to some of the top medical research in the country. And it's been revamped in recent years due to new developers coming into the area and housing being built in what was previously farmland. Some of the major SES indicators that I found were median household income, health insurance, and education level. The median household income was between 55 and 60,000 for Hillsborough and Pinellas County in 2021. About 15% of adults under the age of 65 did not have health insurance. And then one of the most major SES indicators in this area was education level. About 90% of Hillsborough and Pinellas County do have a high school degree or diploma or GED, but only about 1/3 of the population actually has education above high school or a bachelor's degree or associate's degree. So that's a pretty significant difference seen in the area in terms of education level. In terms of a background of HIV and AIDS in Tampa Bay, Hillsborough and Pinellas County have a higher prevalence of persons with HIV than other counties in the Tampa Bay area, and that's in 2021. Hillsborough was about 507.6 persons with HIV per 100,000 population, and Pinellas was right under that at 502.7. However, as you can see, Manatee and Pasco County, which are neighboring counties, have much lower rates of persons with HIV. In terms of some history regarding HIV, the first case ever reported, which was by the CDC, was on June 5th in 1981, and that case was dubbed Patient Zero for the AIDS epidemic. However, research has been able to go back and look retrospective at data. So the state of Florida now reports that their first case was in 1979. Hillsborough County in 1980, and Pinellas County had two cases in which are their first two cases in 1981. The first reported cases of AIDS in Florida were actually linked by sexual contacts to patient zero. And as you're going to see in the next slide, you'll see a map of that. Rates in Tampa Bay were the highest in the late 80s and 90s. You'll see that in another graph as well. And then southern states currently account for more than half or 51% of all new HIV infection diagnoses in the entire United States. So it's definitely a significant problem in the South. Like I said, this is that map. As you can see over here, I'll just annotate it real quickly. The two Florida patients are right here. This is patient zero. So they were linked to a man in Los Angeles by sexual contacts, and then he reported a Florida man who was linked by sexual contacts to him. Therefore, the first two cases reported cases in the state of Florida. This was all through information that patient zero gave to researchers at the time in the 80s. And he was reported to have over 750 sexual partners from 1979 to 1981 when he was diagnosed with AIDS. Additionally, the map just outlines some different diseases that were present in all of these men at the time of AIDS diagnosis, which include Kaposi sarcoma, PCP, and other opportunistic infections. Right. All right, perfect. Okay, so then I also have a graph just showing the comparison of Florida, Pinellas County, and Hillsborough County rates of AIDS diagnoses from 1985 to 2020. As you can see, those rates were much higher in the 90s than they are to date. But there have been some years where Hillsborough and Pinellas County have had higher rates than the state of Florida. One of those times you can see is in 2005 and currently in 2020 as well. Some of the methods of surveillance seen in the area of Tampa Bay are just largely what has been used by the rest of the country. So they're largely self-reporting, medical facility reporting, local health departments, surveying and calling the local community. Tampa Bay might also want to look to use some other surveillance methods in the small percentage of rural populations that they have, but there's also a larger rural area community in neighboring counties. Just a little background of the methods of surveillance. So in 1981, like we had said, AIDS reporting starts with patient 0. And then in 1985, HIV was included in that case reporting, and the greater surveillance system was born, being named the National HIV Behavioral Surveillance, or the NHBS. In 1986, all 50 states were now included in that reporting. And in 2008, the CDC updated it to be confidential name-based surveillance for HIV infection. So there's a lot of information on this slide, but it just is going over the epidemiology of HIV and AIDS in Tampa Bay. So the prevalence of persons living with HIV increased from 408.3 to 418.5 from 2018 to 2019 in the metropolitan area. So just the cities or major cities, which would be Tampa, St. Pete, and Clearwater. However, the incidence of new HIV infection diagnoses decreased during that time period. So this difference in prevalence in HIV shows people with HIV are living longer, which is good because treatment options therefore are working. The HIV-related death rate was 3.1 in 2019 and actually fell to 3.0 in 2020. The total number of people living with HIV in the Tampa Bay metropolitan area is 13,371 people in 2019. It was much higher in the Miami metropolitan area, where a few different cities are included. It was almost 55,000. But in Miami, or in the city of Miami alone, there's over 25,000 people living with HIV. So there's definitely a lot less of people in the Tampa Bay area, but the prevalence is still higher than the entire United States, which was at about 362.4 in 2019. Additionally, just some other information, late diagnosis was more common in rural than urban areas in Florida, and the county level resources were not determined to be a factor in that number. Additionally, the trends and subgroups follow those of the entire country. So Black males and females had higher rates of HIV-related deaths than whites and Hispanics. 1 in 4 Black Floridians have HIV compared to 1 in 284 white Floridians. And then you'll see in the next slide, but men-to-men sexual contact is the highest mode of transmission in Tampa Bay. As you can see, it accounts for 64.63%. The next highest category was heterosexual sexual contact, and then injection drug use, and then a combination, as well as just another category. So this is just showing that, or something that I thought was really interesting was that injection drug use was a much lower percentage. And And there are some efforts in Tampa Bay in order to combat that mode of transmission, which is great. So some prevention and control measures. At the start of the AIDS epidemic, there was a lot of prevention, started with staying away from gay men, which public health officials have had to work overtime to dissolve that idea. But in June of 1982, a pamphlet was published by gay activists in San Francisco about safe sex and was distributing it at a gay pride parade. And that was the first pamphlet of its kind. Additionally, in 1983, the CDC implemented occupational exposure precautions for HIV and AIDS, which finally was documented protocols for healthcare workers to go off of. In Tampa Bay specifically, from 1983 to 1999, Metro Inclusive Health established HIV-specific care for Tampa Bay, and they're the only organization in the area that offers both primary care and HIV care. There's also Tampa Bay Street Medicine, which is operated by USF. They do treatment and diagnosis of the homeless population in downtown Tampa, and they offer needle swaps to limit injection drug use transmission. That's that organization that I mentioned in the previous slide. Additionally, the state of Florida also offers sexual education in K through 12 public schools, and they have additional preventative measures for the state, like routine screenings for HIV, and other STDs, reducing risk of HIV by using PrEP and NPEP for prevention, and increasing community outreach to educate about HIV testing and treatment options. As far as barriers go, they're really not that unique to Tampa Bay. There's a lot of pushback in testing from the LGBTQ population, specifically by gay men who just don't want to know that they have HIV. This is also just seen as far as education level goes. There's a trend with that. So 47% of adults under 65 who have a high school diploma or GED have ever been tested for HIV in Pinellas County, and that has stayed stable since 2016. It increases to over 80% for Hillsborough and Pinellas County for adults with an education more than high school, but still not the most amazing number. Additionally, there's just other barriers, like Tampa Bay Street Medicine is limited in its capacity to do needle swaps. There has been political pushback in regards to sexual education in the state of Florida, and there are some laws going into effect surrounding conversations about the LGBTQ community, which really limits the sexual education that they can do in the state, because it's just limiting the conversation about the that group in general. And then additionally, there's just rising housing and food costs across the United States with inflation, which doesn't help when you're trying to get people tested and they're more focused on things like putting food on the table and making sure they have a place to live. Overall, my assessment of the of Tampa Bay's response to the AIDS epidemic in their area is that they're very focused on it and on the recent concerns seen as well with that increase in prevalence. I think the specialized local organizations like Metro Inclusive Health and Tampa Bay Street Medicine are one of the most effective parts of Tampa Bay's response to the epidemic, and I hope that they continue to use those smaller community-facing organizations to help in their response. You can see that injection drug use transmission isn't as high, which I think definitely the Tampa Bay Street Medicine has contributed to that. But also there wasn't any limited treatment options. That wasn't seen as a barrier. And the prevalence has increased while the incidence has decreased, which is pointing to the fact that those treatment options are working for those people in the area. I definitely think improvements need to be made in areas of education and percentage of population that needs to be tested for HIV. So one prevention strategy that I came up with was the local health department working with one of the major sports teams in the area, like the Tampa Bay Buccaneers or the Tampa Bay Lightning, to do a raffle for a game to one of their home games, and then you can enter the raffle by being tested for STDs at a participating healthcare facility. I thought this was just a great way to get people to be incentivized to get tested, but also encourages a larger conversation that you can have about sexual education and HIV prevention, especially with it being linked to a major sports team as well. Maybe you can even have players just talk about different experiences if they know somebody that is living with HIV, or just has a very inspiring story around the conversation. Overall, like I said, I think Tampa Bay is doing a great job and they're very focused. There's definitely just some areas where they need to improve upon. Thank you for listening to us. I hope it was very informative and you learned something about Tampa Bay and the AIDS epidemic in the area.